Have you decided or have circumstances made it so that it's very unlikely that you will be giving birth to your own child? Do you feel like you've had all the information you need to make that decision? Many women don't realize the whole picture of what it means to not have a child. Many think that not having a child is the completion of your reproductive worries, so to speak. The truth is, not having a child has its own risk and has its own considerations. In making that decision, you should know the whole story. Did you know that there are certain things that are more common, meaning higher risk, when you don't have a child? A topic that no one else is talking about. You do not want to miss today's discussion. Thank you for watching and joining us. And once again, don't forget to hit subscribe. Hey, you guys. So, not having a child is not so simple as that's the end of my reproductive worries and anything I need to be concerned about outside of menopause when I get to that time frame. But there are certain things that are more common in women who do not give birth or give birth at a later age. Let's start with the whole birth situation. So, giving birth, as difficult as it already is, can sometimes be harder when you have never had a child before. And what do I mean by that? Well, one, we know that women who haven't given birth before are considered to be what we call nulliparous, are more likely to have a longer duration of labor. And there are certain conditions that are more common in women who have never given birth before. For example, preeclampsia, and you've probably heard about preeclampsia many times. One of the risk factors for developing preeclampsia is never having given birth to a child before, whether or not you've been pregnant before. And so women who are nulliparous are an increased risk for developing preeclampsia is considered to be one of the moderate risk factors. One of the other things related to pregnancy is the fact that women who have never had a child before and have a child in the advanced maternal age group, especially those who are over the age of 40, have some of the highest risk factors for pregnancy-related complication and death. So it's really important to initiate prenatal care very early, identify what your risk factors are, and having that discussion as to ways in which you can modify those risk factors. And then, of course, being informed of warning signs, warning signals for the things that are more commonly the cause of pregnancy-related complications. So these are just a couple of examples in which not having a child before may change the outcome of your pregnancy, or at least put you in an at-risk group in which you should be aware of. For instance, those who have other risk factors for developing preeclampsia may want to have the conversation as to measures that can be taken that can further decrease your risk, meaning those modifiable factors, or any type of prophylaxis, which is now low-dose aspirin, that can be taken if you have multiple moderate risk factors for preeclampsia. So it's more than just receiving the information and knowing that you're at risk for something, but also then taking that information and saying, okay, I can't change the fact that I've never had a child before, but what are the things that I can change that may then decrease my risk? Women who are nulliparous are the state of nulliparity can increase someone's risk for cancers. I know I said the C word, that word that no one ever wants to hear. But the truth is, there are certain risk factors, and there's an increased risk for breast cancer, ovarian cancer, and uterine cancer in women who have never been pregnant before or who've never given birth to their own child. So let's talk a little bit more about these different types of cancers. So breast cancer, we know, especially in Black women, tend to be diagnosed at a later stage and tend to be more aggressive and have a higher mortality rate. We also know that not having a child before, studies have shown the increased risk compared to women who have had children before is as high as 20 to 40% higher when it comes to breast cancer. We also know that there are other risk factors for breast cancer, right? We know that smoking is a risk factor, an unhealthy weight is a risk factor, sedentary lifestyle is a risk factor, alcohol consumption is a risk factor. So what can we do with this information? Well, some people may ask, why is nulliparity an increased risk for breast cancer? And the truth is, there's not a consensus as to why there is an increased risk in women who've never been pregnant before. There's been a number of theories based on observational studies looking at nuns, for example, and comparing nuns to women who have been pregnant. The initial studies seem to imply that the increased ovulation is perhaps a risk factor that increased the risk for these types of cancers, breast, ovarian, and endometrial. And there's been studies showing that childbirth, especially at a younger age, is protective. There were also theories about whether or not progesterone has some type of protective effect and the level of progesterone that's excreted during pregnancy, whether or not it had a protective effect of decreasing it and ultimately decreasing the rate of these types of cancers. There have been also theories about whether or not the shedding of the uterine lining that occurs as a result of childbirth may have some role or mechanism in protecting women who have had childbirth before against these types of cancers. We know that with breast cancer specifically, never having a child or having your first child after the age of 35 are considered to be risk factors, and breastfeeding seemed to be protective against breast cancer. However, given the fact that we don't really understand the mechanism, but we know that there seems to be an increased risk associated with nulliparity, it's important to have the conversation with your clinician to discuss perhaps those modifiable risk factors. Do you have a healthy weight? Are you avoiding alcohol? Are you a non-smoker? Do you tend to be more active? And if not, then perhaps those modifiable areas may be areas that you can look at. And as we talk about the other types of cancers, there may be other options such as birth control and the benefit of using birth control in some of these instances. But that is a conversation meant to be taken up with your healthcare team, the team that actually knows your whole story. When it comes to ovarian cancer, having your first full-term pregnancy after the age of 35 is a risk factor, or not carrying a pregnancy to term is a risk factor for ovarian cancer. Again, some of the theories behind this has been linked to the rate of ovulation. So again, this is a conversation to go over those modifiable risk factors and see whether or not there's any prophylactic or preventive measures that can be taken to reduce the risk for ovarian cancer. Unlike breast cancer, however, with ovarian cancer, there is no screening method. So with breast cancer, you can discuss whether or not you should use one form of screening guidelines versus another, given your risk factor. Whereas with ovarian cancer, and later on I'm going to mention uterine cancer, there are no standardized screening methods that are found to be effective in reducing the rates of these cancers. With uterine cancer, the risk factor is never being pregnant, especially in those who had an issue with infertility. The combination of the two increases the risk for uterine cancer. We've mentioned before also that there are increasing rates of uterine cancer among Black women, and the uterine cancer tends to have a higher mortality rate amongst Black women. So again, going over those risk factors, such as your weight, for example, whether or not you have any other underlying conditions like PCOS that may increase your risk, and the things that you can do to modify those risk factors is really important. So now that you know that there are conditions that are at increased risk for women who've never been pregnant before, never carried a child to term, or in some cases, pregnant at an older age, then it's important to take this information, go to your clinician and say, what are my personal risk factors? And are there other risk factors that even further increase my risk for breast cancer, or ovarian cancer, or uterine cancer? Or if you're pregnant for the very first time, discussing the things that you are at increased risk for, and then collectively coming up with a plan to decrease and modify the risk factors that may be modifiable, are taking certain measures because your risk is significantly higher than the general population. Having this information and having a discussion is key. This is not intended to make someone more anxious or nervous, but instead to help you identify things that are important and relative to your health without you being surprised by a diagnosis that seem to blindside you when the medical community know that these risk factors exist. So once again, this is Dr. T, always happy to be the hand behind the handle of Healthy Bump Club right here on YouTube, and the hand behind the handle of healthybump.club on Instagram. I hope this information is helpful to you and helpful in your decision-making if you're trying to figure out whether or not you do want to have children, so that you have a more informed decision. For those who have struggled with infertility, we see you. We know that the journey is hard and difficult. But now it's important for you to also have, beyond your fertility journey, other information that's relevant to your overall health. Thank you for supporting our platform. We hope that you look out for other videos or go back into our library of over 100 videos and select those that are relevant to you. Watch, comment, share, like, and of course, subscribe. We thank you for watching, and we see you guys when? The next episode.